populations is at greatest risk for abuse or neglect. Of females between 6 and 12 years of age. B. Children with chronic medical conditions. C. Adolescents who rebel against their parents. D. Males between 2 and 14 years of age. B. Children with chronic medical conditions. 4. Which of the following types of maltreatment is perhaps the most common? A. Neglect. B. Physical abuse. C. Sexual abuse. D. Abandonment. A. Neglect. 5. Which of the following types of maltreatment involves isolating the victim from others, resulting in a substantial change in the victim's behavior or cognitive function? A. Neglect. B. Abandonment. C. Emotional abuse. D. Sexual exploitation. C. Emotional abuse. 6. A man leaves his 4-year-old child home alone while he plays golf with his friends. This is an example of A. Assault. B. Neglect. C. Abandonment. D. Emotional abuse. C. Abandonment. D. Offering unsolicited explanations for abnormal physical exam findings. 8. Which of the following injury patterns is most suggestive of child abuse? A. Burns with splash marks. B. Bruises on the abdomen. C. Bruises on the lower leg. D. Laceration to the chin. B. Bruises on the abdomen. 9. Difficulty walking or sitting, nightmares, and bedwetting are most suggestive of A. Neglect. B. Sexual abuse. C. Physical abuse. D. Emotional abuse. B. Sexual abuse. They resemble bruises, and are found most commonly on the back and buttocks. 11. You are assessing a 6-year-old Asian child who presents with a fever. During your assessment, you note red, flat, rounded lesions on the child's torso. This finding is most indicative of A. Cupping. B. Coning. C. Physical abuse. D. Phytophotodermatitis. A. Cupping. C. Ask your partner to retrieve an extra set of latex-free gloves from the ambulance, as this will enable him or her to discreetly call the police. D. Take deliberate action to ensure your own safety. B. Allow the son to accompany his father in the back of the ambulance. B. The injury was reported to have occurred at 1,420 hours. A disease process that is expected to cause death within 6 months, verified by a physician. 17. Some patients with a terminal illness will continue aggressive medical treatment, hoping for a statistically improbable recovery or attempting to prolong life as much as possible. This is called A. Hospice care. B. Curative care. C. Palliative care. D. Investigational care. B. Curative care. C. Continues, although aggressive, invasive, and uncomfortable intervention cease. 19. Which of the following are often the primary tasks for paramedics who are caring for a patient with a terminal illness? A. Airway care and thermal management. B. ECG monitoring and antidiarrhythmic therapy. C. Antibiotic and antipyretic therapy. D. Pain assessment and management. D. Pain assessment and management. B. Provide quality end-of-life care through pain and symptom management. 21. Morbid obesity is defined as a body mass index that is, a greater than 30 kg per square meter, B between 30 and 39.9 kg per square meter, C between 40 and 49.9 kg per square meter, D greater than 50 kg per square meter. C between 40 and 49.9 kg per square meter. 22. Which of the following would be considered a primary cause of obesity? A lack of exercise, B hormonal changes, C genetic predisposition, D low basal metabolic rate. A lack of exercise. 23. Which of the following factors complicates airway management in an obese patient? A larger upper airway, B limited neck mobility, C smaller patient head size, D proportionately small tongue. B limited neck mobility. 24. Bag mask ventilation of the obese patient would most likely be ineffective when the patient is A. supine, B. apneic, C. semi-sitting, D. in reverse Trendelenburg. A. supine. 25. Assumptions by the paramedic based on stereotypes of a particular communicable disease. A. will maximize the paramedic's safety. B. are a violation of the patient's privacy. C. will expose the paramedic to legal action. D. serve only to undermine patient care efforts. D. serve only to undermine patient care efforts. 26. Adult patients who have a tracheostomy tube in place and are ventilator dependent should receive A. cool, dry air through the ventilator circuit. B. deep tracheal suctioning every other day. C. humidification and heating of inspired air. D. ventilation at a rate of 20 to 24 breaths per minute. C. humidification and heating of inspired air. B. has a 15 mm port that can be attached to a ventilator circuit. C. allows the patient to speak, breathe, or clear secretions from the upper airway. 29. Which of the following interventions is especially important when caring for a patient with a tracheostomy tube? A. suctioning, B. mask ventilation, C. hyperventilation, D. head positioning. A. suctioning. 30. When suctioning and cleaning the tracheostomy of a ventilator-dependent patient, it is most important to A. keep the patient well oxygenated. B. have a new tube readily available. C. suction for no longer than 5 seconds. D. soak the inner cannula in sterile water. A. keep the patient well oxygenated. A. disconnect the patient from the mechanical ventilator and begin bag mask ventilations. B. deflate the cuff of the tracheostomy tube and ventilate the patient in the usual fashion with a bag mask device. A. sending electrical impulses to the diaphragm, causing it to contract and passively relax. 34. You are assessing a patient and discover that he has a ventricular assist device because of severe left heart failure. In this case, the device is most likely connected to the A. left atrium, B. right atrium, C. right ventricle, D. left ventricle. D. left ventricle. 35. You would most likely encounter the presence of a ventricular assist device in a patient who A. has severe emphysema, B. has pulmonary hypertension, C. is awaiting a heart transplant, D. has transient right heart failure. C is awaiting a heart transplant. B. Transport the infant, and monitor her breathing en route. C. Withdraw up to 10 milliliters of blood, and discard it. 38. Unlike a midline venous catheter, a peripherally inserted central catheter can be used for a long-term drug therapy. B. The delivery of antibiotics. C. Chemotherapy in cancer patients. D. Narcotic analgesia administration. A long-term drug therapy. 39. Triple lumen central catheters are usually placed in the A. External jugular vein. B. Internal carotid artery. C. Antecubital vein in the arm. D. Subclavian or femoral vein. D. Subclavian or femoral vein. 40. Which of the following vascular access devices is tunneled under the skin and placed into the superior vena cava? A. Midline catheter. B. Broviac catheter. C. Dialysis catheter. D. Double lumen catheter. B. Broviac catheter. A. Aspirate 5 milliliters of blood and then block the flow in the line with a crimping device. C. Support his breathing, continuous medication infusion, and contact medical control. 43. An unresponsive woman with diabetes is wearing an insulin pump. Her blood glucose level is 24 mg per deciliter. You should A. Give a 20 ml/kg crystalloid bolus. B. Administer 0.1 mg of glucagon IM. C. Give her half the usual dose of dextrose. D. Ensure that the insulin pump is turned off. D. Ensure that the insulin pump is turned off. D. Wash your hands and apply personal protective equipment. 45. The purpose of the wafer that is included in an ostomy kit is to A. Protect the skin from irritation. B. Seal the ostomy bag to the skin. C. Maintain sterility of the ostomy bag. D. Cover the stoma until the bag is attached. A. Protect the skin from irritation. 46. Following removal of an ostomy device and cleansing the stoma, you should A. Apply the new device over the stoma. B. Flush the inside of the stoma with saline. C. Place a clean gauze pad over the stoma. D. Cover the stoma with the provided wafer. C. Place a clean gauze pad over the stoma. C. Have had a surgical procedure that directs the large intestine out through a stoma in the anterior abdominal wall. D. Coat the end of the catheter with an anesthetic gel. C. Continue inserting the catheter until the Y between the drainage port and the balloon port is at the tip of the penis. B. Does not involve inflation of a balloon to hold the catheter in place. 51. The female urinary meatus is located A. Superior to the clitoris. B. Just above the vaginal opening. C. Inferior to the vaginal opening. D. Between the vagina and perineum. B. Just above the vaginal opening. A. Insert the catheter another 1 to 3 inches. 53. The fistula used for hemodialysis is a surgical connection between A. Two large veins. B. An artery and a vein. C. Two large arteries. D. A vein and the peritoneum. B. An artery and a vein. D. Creates a raised area beneath the skin that resembles a large vessel. C. In peritoneal dialysis, fluid is instilled into the abdominal cavity. 56. When treating a dialysis patient, it is especially important to A. Keep the patient in a supine position. B. Elevate the arm with the AV fistula. C. Carefully titrate any IV fluids given. D. Treat acidosis with sodium bicarbonate. C. Carefully titrate any IV fluids given. 57. A dialysis patient requires pharmacologically assisted intubation. Which of the following medications should be avoided? A. Midazolam, B. Etomidate, C. Vecuronium, D. Succinylcholine. D. Succinylcholine. Ask the dialysis technician how long the patient has been on the dialysis machine. B. Cerebrospinal fluid absorption into the bloodstream is reduced. 60. The outflow catheter of a cerebrospinal fluid shunt is most commonly placed into the patient's A. right atrium, B. pulmonary cavity, C. peritoneal cavity, D. left ventricle. C. peritoneal cavity. B. Visual disturbances, headache, and altered mental status. 62. The majority of current hemodynamic monitoring involves placement of different types of catheters into areas within the A. central nervous system, B. brain and spinal cord, C. pulmonary circulation, D. cardiovascular system. D. cardiovascular system. A. Remain in a supine position with his legs straight. C. Inflating a balloon during diastole, which pushes blood into the systemic circulation. 65. The transducer or drainage system of an intracranial pressure monitor is typically aligned at the same height as the patient's A. forehead, B. ear canal, C. eyebrow, D. temporal bone. B. ear canal. 66. Down syndrome is a condition in which a chromosome 23 fails to separate. B. The ovum contains 21 chromosomes. C. A triplication of chromosome 21 occurs. D. The human somatic cell contains 24 chromosomes. C. A triplication of chromosome 21 occurs. 67. Characteristic physical features of Down syndrome include A. protruding tongue, B. an excessively long neck, C. bulging of the nose and face, D. downward slanting eyes. A. protruding tongue. B. A person's mental status can influence his or her physical well-being, and vice versa. D. Insufficient development of the brain that results in the inability to learn and socially adapt at the usual rate. B. Some patients with autism are able to easily solve complex mathematical problems. 71. The majority of acquired hearing loss in children and adults is the result of A. tumor on the acoustic nerve, B. frequent middle ear infections, C. excessive exposure to loud noise, D. long-term use of salicylates. C. Excessive exposure to loud noise. A decreased sound uptake through tiny hairs within the cochlea. 73. A person is able to hear, but is unable to interpret speech when other background noises are present. This is consistent with A. Auditory neuropathy. B. Conductive hearing loss. C. Sensorineural hearing loss. D. Central auditory processing disorder. D. Central auditory processing disorder. 74. When troubleshooting a hearing aid that is not working, you should A. Avoid attempting to clean the device. B. Soak the device in hydrogen peroxide. C. Ensure the device is set to telephone mode. D. Carefully clean the device with an alcohol prep. Avoid attempting to clean the device. 75. By placing one hand on your forehead and your other hand over your abdomen, you are asking a hearing-impaired person if he or she A. is hurt, B. feels sick, C. needs help, D. is in pain. B. feels sick. 76. A person with amblyopia has a difficulty visualizing object from afar. B. An area missing from his or her visual field. C. Partial or complete vision loss in one eye. D. Difficulty visualizing objects that are close. C. Partial or complete vision loss in one eye. 77. A patient presents with a sudden onset of unilateral eye pain and blurred vision. You should suspect acute optic nerve hypoplasia. B. Acute angle closure glaucoma. C. Central retinal arterial occlusion. D. Spontaneous retinal detachment. B. Acute angle closure glaucoma. 78. Dysarthria is the inability to make speech sounds correctly. B. A speech disorder that primarily affects adults. C. The loss of ability to communicate in speech or writing. D. Caused by damage to the language center of the brain. The inability to make speech sounds correctly. A paralyzed patient has lost the ability to voluntarily move a body part. 80. During your assessment of a patient with paraplegia, you touch the patient's leg and he screams in pain. This is an example of a paresthesias. B. Hypoplasia. C. Hyperplasia. D. Hyperasthesia. D. Hyperasthesia. 81. Rheumatoid arthritis, A. is more common in the elderly. B. does not respond to analgesia. C. can affect other body systems. D. occurs secondary to an infection. C. can affect other body systems. B. chemotherapy weakens a patient's immune system. A non-progressive, bilateral neuromuscular disorder in which voluntary muscles are poorly controlled. 84. Common complications associated with cerebral palsy include all of the following: EXCEPT, seizures. B. Visual impairment. C. Mental retardation. D. Cardiovascular disease. D. Cardiovascular disease. B. A defective gene that makes it difficult for chloride to move through the cells, which causes unusually high sodium loss and abnormally thick mucus secretions. A chronic central nervous system disease caused by destruction of the myelin and nerve axons within the brain and spinal cord. D. Genetic disease that causes a slow, progressive degeneration of muscle fibers. B. The fetus's spinal column does not close properly or completely and vertebrae do not develop, leaving a portion of the spinal cord exposed. C. Polio initially presents with a headache, sore throat, fever, and vomiting. Ask the patient's family